Today we're going to be talking about urinary tract infections, their symptoms, and the role of urine culture and sensitivity.
Patient DL, an elderly female, was admitted to the hospital 6 weeks ago for rehabilitation following a stroke. Today, her family voices some concerns about her urine appearing cloudy and having a foul odor. They believe she has a urinary tract infection and requires investigation and antibiotics. DL has had a Foley catheter since admission. She is currently afebrile with stable vitals and denies any pelvic or flank pain. She has a mild cognitive impairment due to her stroke, which has not worsened. Today is the first day her urine is noted to be cloudy and foul-smelling. Inappropriate antibiotic use increases the risk for both bacterial resistance and complications from therapy. Resistance can make treatment of future infections more challenging, and complications, such as C. difficile infection, are a risk for both the patient and their staff and neighbors. Both of these are a major cause of patient mortality. Antimicrobial stewardship programs, known as ASPs, aim to curb inappropriate antibiotic use for these reasons. What's considered a symptom of a urinary tract infection depends on whether or not a patient has a urinary catheter. In patients without a catheter, symptoms include dysuria, increased urinary frequency, suprapubic pain or tenderness, costovertebral pain, and new onset or worsening incontinence. However, the signs for patients with a Foley catheter are different and include pelvic or flank pain, fever, rigors or chills, and new onset hematuria, new onset delirium without another clear cause, and new onset lethargy, again without another clear cause. Changes in urine appearance or odor are not signs of a UTI on their own. They may be caused by other things such as dietary changes or even dehydration. Urinary retention in patients with a spinal cord injury is also not an independent sign. This is a major challenge with antimicrobial stewardship.
Many clinicians
Automatically investigate or treat non-specific signs such as cloudy urine, even if there are no other symptoms. And many staff members might think, what's the harm in collecting a urine C&S? Simply put, even positive urine cultures aren't a definitive sign of infection, but they can create pressure for physicians to treat, even if it would be inappropriate. These false positives may be because of contamination or colonization. Contamination can occur if the sample was drawn inappropriately, such as drawing a urine sample directly from a Foley bag. Colonization means that the patient has bacteria growing in their urine, but that bacteria is not causing an infection. Patients who have had a Foley catheter for over 1 month have an 85 to 100% chance of being colonized. Furthermore, using antibiotics to eradicate bugs patients are colonized with is often ineffective and simply increases the risk of complications or further resistance. Despite this, urine cultures have been shown to be a major cause of inappropriate antibiotic treatment. Even if there are no clinical signs, physicians may be compelled to treat because of factors like pressure from patients or family, or simply a lack of familiarity with a patient, such as if they're on call. Ultimately, antimicrobial stewardship isn't just about how we use antimicrobials, it's also about how we investigate and assess our patients. Key messages. Report suspected urinary tract infections to the physician only when patients show true signs and symptoms. Document concerning signs and symptoms appropriately. Use correct procedure when collecting samples. When needed, educate patients and families on appropriate monitoring and the risks of overtreatment. And finally, as with all infections, if both culture and sensitivity and antibiotics are ordered, collect the sample before giving the first dose of antibiotic.